Welcome back, I'm Rachel, and in this video we're going to go over the structure of the zygomatic bone. The zygomatic bone is located on each side of the skull, lateral and below the orbit, also known as the eye socket. If we take a closer look at the front view of the skull, we can see highlighted in red the zygomatic bones on each side of the skull. If we now look at the right lateral view of the skull, we can again see highlighted in red the zygomatic bone. Now we are going to look at the different landmarks and features of this bone. Here we have two views of this bone, the anterolateral view and the posteromedial view. The zygomatic bone has three surfaces. The first of these is the lateral surface. This surface is convex in shape and faces towards the outside of the skull. The second of these is the temporal surface, also known as the posteromedial surface. The third surface is the orbital surface. The orbital surface forms part of the bony orbit. There are 5 borders on this bone. The first of these is the anterosuperior border, also known as the orbital border. This border forms the border between the lateral surface and the orbital surface of the bone. The second border is the antero-inferior border, also known as the maxillary border. This border forms an articulation with the maxilla bone. The third border is the posterior-superior border, also known as the temporal border. This border forms an articulation with the temporal bone. The fourth border is the posterior-inferior border, also known as the masseter border. This border is rough and forms the site where the masseter muscle attaches. The fifth border is the posteromedial border, also known as the sphenoid border. This border is serrated and forms an articulation with the sphenoid bone. The zygomatic bone also has 3 processes. The first of these is the frontal process, located at the top of the bone. The second process is the temporal process and is located on the lateral side of the bone. The third process is the maxillary process, which is located on the medial side of the bone. Another type of landmark observed on the zygomatic bones are the foramina. There are 3 foramen found on this bone. The first of these is the zygomaticofacial foramen. This foramen is found near the center of the lateral surface of the bone. It serves as a pathway for the zygomaticofacial nerve, artery, and vein. The second foramen is the zygomaticotemporal foramen. This foramen is found on the temporal surface of the bone. It serves as a pathway for the zygomaticotemporal nerve. The third foramen is the zygomatico-orbital foramen. This foramen is located on the orbital surface of the bone. This foramen is the opening to a canal that splits off into 2 canals that exit at the other 2 foramen already mentioned. Now we're going to go over the bones the zygomatic articulates with. Each zygomatic bone articulates with 4 other bones. The first bone it articulates with is the frontal bone. The frontal process of the zygomatic bone articulates with the zygomatic process of the frontal bone. This forms the zygomaticofrontal suture. The second bone it articulates with is the temporal bone. The tip of the temporal process of the zygomatic bone articulates with the zygomatic process of the temporal bone. This forms the zygomaticotemporal suture. Together these structures of each bone form the zygomatic arch. The third bone it articulates with is the maxilla bone. The maxillary process of the zygomatic bone articulates with the zygomatic process of the maxilla bone. This forms the zygomaticomaxillary suture. The inferior region of the posteromedial border also articulates with the maxilla at the orbital surface. The fourth and last bone each zygomatic bone articulates with is the sphenoid bone. The superior region of the posteromedial border of the zygomatic bone articulates with the greater wing of the sphenoid bone. This forms the sphenozygomatic suture. Now we are going to go over the muscles that attach to the zygomatic bone. Each zygomatic bone has 5 muscle or ligament attachments. The first of these attachments is the masseter muscle. This muscle attaches to the posterior-inferior border of the bone. The second and third attachments are the zygomatic muscles, zygomatic major and zygomatic minor. These muscles attach to the lateral surface of the bone. The fourth attachment is of the lateral palpebrae ligament. This ligament is a suspensory ligament of the levator palpebrae superioris muscle. This ligament attaches to the frontal process. The fifth and final attachment is of the origin of the levator labii superioris muscle. This muscle originates at the maxillary border. And that concludes this video on the structure of the zygomatic bone. I hope you found it helpful.
Thank you for watching. If you want to support this channel, please subscribe and check out more of my videos.